and the two counties still in red.
Also, a rural health system joins us to share its successes in battling the virus and the steps being taken to return to normal health care. Plus, talking recovery and resources with two nonprofit leaders in our communities. And honoring the fallen this Memorial Day weekend.
Good morning, everyone. Thank you for joining us live online and on there for this COVID-19 weekly briefing. I'm Chris Barrett for the COVID-19 briefing team. This program is now in its 7th week. We hope you'll find our information useful and share it via social media feeds if you're watching online or on YouTube. First, we want to thank Blue Ridge Cable TV 13 and East Stroudsburg University for partnering with the Pocono Mountains Visitors Bureau to bring you this program. Remember, you can get up-to-date information at our website, poconomountains.com/COVID-19. As we begin this morning, we'd like to take a look at the numbers, as well as review the governor's phased reopening plan and what that means as we walk through the remaining process. Today marks the first day that Carbon and Wayne counties progressed to yellow from the red phase. On the screen now is the yellow phase. Work and congregate settings and social settings. As you can tell, there are still some social distancing guidelines that have been suggested by the governor. Now let's take a look at the green phase. The green phase, to the left, all businesses must follow CDC and PA Department of Health guidelines. Social settings also, aggressive mitigation, outdoors are lifted, and individuals must follow CDC and PA Department of Health guidelines. Now the numbers. This week we are transitioning to graphs to highlight our progression and review future case projections. So the first slide shows with the red line the 10-county NEPA region. The blue line shows the 4-county Pocono region. The green line across the bottom of the screen is the 50 new case target. You can see right now we're sitting at 52 cases. The next slide looks at the 14 days per 1,100 people. Carbon, Monroe, Pike, Wayne, and the 50 new cases target are all shown. As you can see, cases are declining nicely, and we have a projection that we'll be getting to zero, hopefully very quickly within the next few weeks. Next slide. New COVID-19 cases in 14 days per 1,000 people. This is a 30-day future projection, and the trend lines are red for the 10-county NEPA region and blue for the 4-county Pocono region. The green line, of course, is the 50 case target. You can see what we're looking like there. The next slide is for Carbon, Lehigh, Northampton, Schuylkill, and of course the target green and the 50 case line. Again, this information is at poconomountains.com/COVID-19. In previous briefings, presidents from St. Luke's Hospital, Monroe Campus, and Lehigh Valley Hospital joined us. This week, we're grateful to have the CEO of Wayne Memorial Hospital System, Dave Hoff. Wayne Memorial Hospital is located in Honesdale, Wayne County. Great to have you, Dave.
Well, thanks for having me in, Chris.
It's great to see you again. And Wayne County has fared really, really well. That's nice to see. What do you attribute that to?
Well, we would hope as a healthcare organization, we did a lot of public health advertising, promotion, education, and we think that had a little bit of an impact in our area. And we also think we just had safe practices instilled in our hospital. And I think we got the message out to the community very, very well.
You guys really did. And Pike County, which you also served, that had a large number of cases. So what has that economic impact been like for you guys?
Oh, it's been tremendous. I think all hospitals throughout the whole United States have been hit really, really hard. Why is that? Because we were really forced to give up our routine business. We were forced to give up elective surgery. Why is that? Because there was a real shortage of personal protective equipment in the United States, and they wanted to keep that available for the COVID-19 influx of patients that the government and CDC expected to occur in a lot of regions throughout the United States. We were fortunate that our region, Wayne County, as you said, fared very well, and we did not have the influx that was expected. And because of that, our PPE levels were maintained very well. Our staff Our patients were very well protected. And another thing, Chris, that really put us in a unique position, back in the fall, we opened a brand new patient tower. And because of that, we had an old patient tower that still hadn't been renovated for new programs, and we were able to use one floor of that patient tower and turn that into an isolation area with all negative pressure rooms. We had 21 negative pressure rooms. That's a lot more than a lot of the major medical centers in the United States have.
So that worked really well for you.
It worked great for the COVID-19 patients. Our staff felt very protected going up into that unit, and they helped each other out. It was a real team effort by our physicians, our nurses, our respiratory therapists, our management. They worked really, really together well as a team, supporting each other and making sure we did the right thing when it came to patient care and patient safety.
And we have a package to show. We're not going to show that right at the second, but really what struck me was how the spirit of team at Wayne Memorial, I mean, that came through very clearly to me when I took a look at the package, and I think that's one of the reasons why you guys were really successful.
We put so much emphasis on that, of really the education with our staff, making sure our staff felt reassured about what they were doing. We allowed people, if they felt uncomfortable, we allowed them in many cases to change jobs, to really work in a different unit if they felt uncomfortable. But we really tried to get everybody up to speed, and our team really wanted to pitch in. They are healthcare providers. They really wanted to do the right thing for our community and keep everyone safe.
So you and I talked a little, Dave, before the program. And one of the challenges for you is now with Wayne being at yellow, you have a number of counties surrounding you that are still at red. So how do you think what do you see in the future there?
Yeah, and as your viewers would know here, we are a tourist area. And so a lot of people come into our area, even from the region and from out of our region, particularly during the summer months with Lake Wallenpaupack up there. So we are concerned about that. We want to just make sure that people, when they're out and about, try very, very hard to maintain their social distance. If at all possible, wear a mask. But again, it's incumbent upon all of us to continue to have safe practices in place if we expect to conquer this terrible, terrible virus.
And thank you, Dave. So in fact, the measures taken by Wayne Memorial Hospital and its physician affiliate Wayne Memorial Community Health Centers are significant. And so Brianna Strunk takes a look inside the hospital in one of its clinics. You'll enjoy this.
Wayne Memorial Hospital is the go-to place for healthcare in Wayne and Pike counties.
We're such a vital resource for the community, not like we have a hospital across the street like they do in some other towns. So we're it for a large geographic region.
When COVID-19 hit, the hospital made some adjustments like limiting visitation and developing a separate isolation unit for COVID-positive patients.
We were real concerned when this first happened that our community would be resistive and challenge us what we were doing. But everybody understood how important it was to stay home, stay safe.
In fact, people started avoiding the hospital for routine yet important care.
We believe conditions in the community may have worsened for some people because they have delayed their care.
Good afternoon, Homestead Family Health Center. Lisa speaking.
Doctors want to assure you it is safe to visit your provider.
And I'm just going to say goodbye and
In
throw
fact,
in a Pocono promise.
televisits are transitioning back to the traditional in-person visits.
We really do feel like the office is safe. First of all, the numbers are really low here in Wayne and Pike County, certainly in Wayne County. So the odds of you getting exposure to something in our office is just exceedingly low.
Clinics are taking extra precautions, frequently sanitizing surfaces, pre-screening for COVID symptoms, spacing out waiting room chairs, and requiring masks.
The diabetes, high cholesterol, hypertension, heart disease, strokes, these are much more common causes of death right now in the U.S. than COVID-19.
Proving the hospital is safe and prepared, Wayne Memorial leaders say to date, no employees have been infected with COVID-19 at work.
We're probably one of the few hospitals throughout the United States that can say that.
For Pocono Television Network, I'm Brianna Strunk.
Dave, it was great. This was a great segment. We learned so much, and we're so blessed in our community to have 3 great health systems. And we're so happy that you were able to spend time with us today. So thanks for coming in, and hopefully we'll talk to you again in the future.
Well, thanks for inviting me.
Oh yeah, thanks for being in Wayne County. Right now, we do have some other things to update you on. We'd like to share an update for a new program introduced by the Pocono Mountains Visitors Bureau. That is the Pocono Promise. The Pocono Promise is our region, is our pledge as a region and by each individual business to abide by the public health guidelines established by the CDC as well as the PA Department of Health. In this past week, we've seen more than 230 businesses sign the promise throughout our 4 counties. Owners or managers of any business throughout our region can go to PoconoMountains.com/Pocono Promise and adopt these guidelines and protocols. This is a free service. The guidelines and the promise apply to everything from restaurants and hotels to professional offices and barbershops. The Pocono Promise is designed to help the public and each business's employees to realize that the right steps are being taken to keep them safe and healthy. We have had hundreds sign the Pocono Promise already and hope hundreds, if not thousands more, will do so as we get ready to reopen the Poconos for business. It's easy. Just visit PoconoMountains.com/Pocono Promise for all the details and sign up online. Jim Hamill with the Pocono Television Network has more.
From across 4 counties in the Pocono Mountains and including businesses of all kinds, the Pocono Promise is being made and kept. County leaders, along with business owners, met in a virtual signing ceremony to commit together to uphold that promise for Pocono residents, employees, and guests as the Pocono Mountains reopens.
For us in the Pocono destination, it means that the entire destination is getting together and all the business owners are making sure that we commit to a consistent, safe, clean environment for all of our guests that come to our destination.
Great Wolf Lodge, Kalahari Resorts and Conventions, and Camelback Resort all signed the promise together, signaling their commitment to work together on maintaining the highest public health standards when they reopen to the public.
We do compete on a daily basis, on a year-round basis, but this is the time to focus on the bigger picture, which is the Poconos and getting the Poconos reopened and being able to communicate a confidence that we can safely and comfortably and consistently serve our guests and our community.
The Promise is a voluntary program that the Pocono Mountains Visitors Bureau has helped to create to focus on how to reopen safely by adhering to federal and state health guidelines.
This effort brought together state and local government as well as the business community to collaborate in one common mission to ensure as we reopen that we're doing it safely, not only for the team members who are employed by each business, in addition to the guests who are coming in, and making sure that everything is done as safely as possible to mitigate COVID-19.
Everything from using proper cleaning techniques to checking the health of staff before they show up for work. Those measures are already in place at Wallenpaupack Brewing Company in Hawley.
As soon as we heard about the Pocono Promise, we posted up our signs immediately. We want our guests to feel comfortable as well as the local business community, and we're really excited to get on that and get started and welcome people back to the area as summer's gearing up here. And we want them to know we're doing everything in our power to be safe and to do this the right way.
I think the Pocono Promise is a great thing. It gives guidelines to a lot of businesses that might not know where to start. I think that it's going to help create unity within the communities and the businesses in the Pocono regions.
All you need to do to sign the Pocono Promise is fill out the brief form online. You can then download materials and guidelines to help everyone who comes in your door know you've made a promise to them, and they should make a promise to you.
Making sure that we can communicate effectively to our staff and to our guests and to our community that we've taken all the appropriate measures to protect everyone involved and open up safely, get the economy going, and also give our guests that level of comfort that they need to come back out.
The folks at Barley Creek Brewing Company have also taken the pledge, one of roughly 200 businesses and organizations signing the Pocono Promise in just its first week. To learn more about the Pocono Promise, go to PoconoMountains.com/Pocono Promise. Jim Hamill for the Pocono Television Network.
Now, this Pocono Promise was signed by one of my favorite people, who I'm actually going to introduce right now. We have Marlyn Kissner, Executive Vice President, Northern Region, Carbon Pocono, and Lehigh Chambers. That's a lot. and Michael Tukeva, President and CEO of the Pocono Mountains United Way. And truthfully, these are two of the folks who day in and day out, they've worked tirelessly for our communities within the Pocono Mountains. And really, there's a lot of stories to tell. I know we have a slide that we really want to start this with, and that slide's really going to show where we're at right now with unemployment claims, which unfortunately we'll kind of talk a little bit about here. But we have the highest unemployment claim rate in the country. And last week we did have some folks on from Mario Scavello and Rosemary Brown's office, but these numbers have been updated since then. So as of 5/19, there are 1,888,000 new regular unemployment claims since 3/15. That equates to 1/3 of the PA workforce, and they're unemployed. And the PUA is the pandemic supplement. 277,000 folks have applied for that. By way of comparison, last year 775,000 initial claims were filed for unemployment in Pennsylvania for the whole year. So that kind of shows where we're at right now. So I think first we're going to turn to Michael Tukeva. And Michael, thank you so much. I know a lot of the great things the United Way has done and continues to do, and we're grateful for that, to have you guys in our community. But what are the immediate needs that you guys have addressed as a United Way related to COVID?
Certainly. I think our community quickly recognized that we needed to respond and then look towards recovery. And the way we took that approach was, let's collaborate and coordinate our efforts. And that has been one of the most amazing things of our community, is its willingness to come together and develop new solutions. Because with that, we had to innovate, think big, think differently, and change some of our best practices into our next practices.
So the first thing you guys really, the Crisis Response Fund, so I know we have a slide on that, that was really the first way you guys really started to react to what we were experiencing with COVID, correct?
Yes, that was our call to action to our business community and the philanthropic folks of our community, that we needed their resources to help the immediate response. And we've been able to use those funds to make sure that people are being fed, that they are housed. We've been able to help both the university and the college in supporting their students that needed some additional assistance, right, so that they could continue their learning, and to make sure that people would stay sheltered.
So those were really the immediate needs, right, over the first 4 to 5 weeks. As this continued to roll out, what were your other concerns, and what were you hearing?
One of the other big concerns was around the housing. The fact that there is a moratorium in place means that people cannot be evicted. But we wanted to really stress that there was a large concern from landlords and tenants about rent being paid. So we surveyed our landlords and found out that 93% of them would be willing to work through some of the issues that have been developed because of COVID to prevent eviction. And so we developed this information that we think is really important about asking for help, pay what you can, and then keep your home. Asking for help means that taking that step to reach out to service providers and your landlord to discuss your needs. Don't wait too long to have those conversations. To pay what you can, as people go throughout their days and their weeks, those rent payments will eventually be due. Even though they cannot be evicted at this moment, we want them to still pay what they can so that it isn't a large bill in the next couple months.
So Marlyn, I wanted to ask you too, what was your, from the business community, what was your first reaction to the rapid shutdown? What did you guys think?
Well, I'll tell you, Chris, when it first happened, I think everybody was in a bit of shock. And we thought, you know what, we're going to go home for a couple of weeks, get what we need to do to really get this under control. And in my mind, I thought, wow, we'll be back. We'll be back week 3, ready to go. And so I really think, again, at first it was the shock of what's happening, and then let's get safe.
Right.
That there was no question. Go home, get safe, and then we'll kind of ride it out for a couple of weeks.
And now that kind of we've been through that period, what surprised you most about the sheltering in place? What was the thing that because I know we talked a lot about this over the last few weeks. What was your biggest surprise?
We did, and I'll tell you, Chris, what has been amazing to me is the way that our small businesses are able to really be resilient during this time. They found out ways that they can do business without being open. And so they also started thinking about, when we do open, how can we do this safe? And what kind of practices do we need to do? So I think, again, what was just so welcoming and really even surprising at times is that they really did learn how to do business and how to keep going. Not all of them, unfortunately, and they're the ones that we really had to come in and help save with the grant and some of the loans, but for the most part, they're ready to roll.
And as a representative of the chamber, you worked with a lot of small businesses directly.
Yes.
To walk them through the PPP process and everything else. So tell us about that.
Yeah, absolutely. Like you said, in the beginning, all of a sudden, when we figured out we weren't going back to work in 2 weeks, how are we going to keep the lights on? How are we going to pay the rent? So the chamber got involved right away, $300,000 grant that went out to a lot of small businesses, $1,000, $1,500. That helped pay for rent. That also really helped pay utilities. We then were able to navigate a lot of the really crazy PPP funding, because a lot of businesses didn't know where to click. They didn't know who to call.
Right.
So we had that ability for one-on-one conversations to get people through it.
And you guys continue to do that. Before I go back to Michael, I have to ask you, our chambers are so well known for great networking events, right? That's a great benefit. Mm-hmm. How did you accomplish that without being face-to-face? That must have been really tough.
At first, we thought, wow, how is this going to work? Because yes, networking is how people do business, but we were able to truly turn that into a virtual networking, and we're finding that we had people that really we never even touched before in the virtual world. So I saw a benefit to that, and we were able to get to people really fast, really quick in their homes. And we had educational programs, we had networking programs, we had fun happy hour programs. So honestly, we just found a whole new way to network.
And I really, you guys are so innovative, like the Carbon County Strong program.
Yes.
So I noticed you're wearing that t-shirt today. So Carbon's going to yellow today. So tell us just a little bit about that.
We are. We're so excited, and really the collaborative efforts of the commissioners, our legislators, you, Chris, the Pocono Mountain Visitors Bureau. We're so excited. We had 2 small businesses come to us and say, we want to give back, Colossal Radio, Frontline Graphics. So tomorrow is Carbon County Strong Day. And so we can't wait. We're back. We're ready to roll. And we want businesses to know we're here for them. But we also want visitors and all of our community to know that our businesses are ready.
And it's great. We also have Wayne County, as you know, we just talked to Dave, going to yellow today, and we hope there's some announcements about our remaining counties here in the Pocono Mountains as we go through that, and we know you're going to be really busy moving forward. But I want to get back to you before we end, but Michael, I got to get back to you too. One of the things that we had talked about even before the show was now families being together all the time. Mm-hmm. What are you kind of hearing and seeing there with families being locked down essentially for 2 months?
Yeah, we have concerns at a state and national level about child abuse reporting and domestic violence in homes. And so we are having those conversations about how do we promote just being a good neighbor by reaching out to those that are around you, by being hypervigilant and mindful of what you see, whether it is on a Zoom call or just by who you're interacting with in your neighborhood. We want people to call these numbers from Children and Youth and the Childline hotline if they suspect abuse. And often people think that they might be creating a problem if they make a report. But the opposite is really true. What they're doing is they're looking to solve the problem. We want people to not be bystanders, but to be upstanders, to make sure that they are caring for their entire community and report if you see something that looks suspicious or that is concerning.
And then before, I just want to make sure I ask you this question because we have some time left, but I just want to ask you if people need help, because I know you and I talked about this a lot. There are a lot of folks now that unfortunately need help. They've never touched any type of system like this before. Mm-hmm. What do you suggest that they do if somebody needs help?
Yeah, the real simple solution is to reach out to your local United Way or to call 211. Yeah, both of these resources are available to our community and can help navigate some of those questions about how to access services within your community.
And I know that last week, as you probably saw, we had Kristen Bush on and we had Mackenzie Strunk, and they walked us through the unemployment issues that are happening. I mean, hopefully they're getting through that. Thankfully, we have a lot of local folks from our state reps and senators' office that are walking people through that whole process, but it seems like that's been an issue too. but it's good to know that people can reach out and that there's somebody definitely there. And I wanted to just ask very quickly, Marlyn, I think, because we're kind of running a little bit on time, but these two guys are really the pillars of our community and they're so helpful. But I wanted to ask you, Marlyn, what do you think the business climate will look like 6 months from now? I mean, that's the question I think everybody's asking. What is our community going to look like? And I know you guys are doing some great things to look at sustainability and rebuilding and reopening. What about you?
Well,
Marlyn, what do you think our business is going to look?
You know, and again, Michael and I work very closely together, community, business. I think we're just going to see a different way of people doing business. And the silver lining of all of this has been to see how businesses can do work virtually, but also get back into doing things at somewhat of a normal level. I know we have to have different guidelines, CDC guidelines, so things are going to look different, but I think I see a little bit of a hybrid. I see us using technology more, I see us doing virtual events as well, but then I also see us getting back to that normal and really supporting one another. So I have a lot of hope. People know that about me, that we definitely have hope for the future. We're going to work together. The collaboration is key, as you know, that we'll figure it out. We're resilient people. We have resilient businesses with really big hearts. So I just see a hybrid, but we'll be back, absolutely.
And that's what really struck me in both these areas. I'm so proud to be involved with the community where a lot of our major partners, our major business operations, like a Kalahari, like a Camelback, like a Great Wolf, they really open their doors in ways that they don't shout up from the mountaintops. And the smaller businesses have done it. We've worked with the health systems. We've worked with our governmental officials. We've worked with our county commissioners, our state and local governments. And it's been really a process of hopefully we can keep this going as we continue. But unfortunately, I know we could probably talk a long time. We're out of time. I'm so grateful you guys were here today. You're watching the COVID-19 weekly briefing from the campus of East Stroudsburg University, brought to you by the Pocono Television Network and Blue Ridge Cable TV 13. We want to thank Kim Bell, the general manager of TV 13, and our director, Zach Booth. In addition, thanks to Kurt Burton from ESU. You can also watch this live streaming on YouTube and afterward on PoconoMountains.com/COVID-19. We'll be back next week with new guests and critical updates. For you, before we go, we want to share some poignant reminders of the sacrifices so many have made while in service to our nation. This weekend, we observe Memorial Day. Throughout our 4 counties, memorials mark the importance of something sacred, something very sacred. You probably have passed them hundreds of times without a thought. These memorials are to those who answered our country's call and made the ultimate sacrifice. We wish you all a safe and enjoyable holiday. Remember, make sure to thank a frontline hero. We'll see you next week with another edition of The Briefing. Until then, I'm Chris Barrett. Thanks for watching.
Do your part by being informed. Visit PoconoMountains.com/COVID-19.